Alright, so this is inserting an NG tube. I would begin by gathering my supplies. I have here my 12 French stomach tube and syringe, some gloves, pen light, my stethoscope, tape. I have a basin here with some tissues and a glass of water, and then the lubricant in a pH measuring strip, and a towel here. So then I'm going to go ahead and do my critical elements. So introduce myself to the patient, identify the patient with 2 forms of identification, go ahead and provide the patient with privacy, perform hand hygiene, ask if there's any cultural or religious concerns that I should know about, and then explain the procedure to the patient. So today I'm going to be inserting an NG tube in your nose. It might be a little bit uncomfortable. Is that okay with you? All right. So then I'm going to go ahead and assess the patient's nares with my pen light here to see which one that I should go into. So looks like they both look about the same, so I'm going to go ahead and go into the right nare. All right, so then I would assist the patient into a high Fowler's position, which he is in, as you can see, and put a pillow behind their head, and then go ahead and establish a signal for the patient. So if at any time you feel discomfort to the point that you cannot handle it and you would like the procedure to stop, just go ahead and lift up your right or left hand and we'll go ahead and stop the procedure, all right? All right, so now I'm gonna go ahead and prepare my tape. So I have some cloth tape here. I'm gonna prepare 4 strips of it, and by ripping it off and then ripping it in half again. 1, 2, 3, 4. And since I'm right-handed, I will be standing on the right side of the patient. I'm going to go ahead and drape a cloth over the patient's chest here, and might fall, and provide the patient with a emesis basin and some facial tissues right here. Okay. Next, I'm going to go ahead and don my procedure gloves right here. Then I will measure the length of the tube. Go ahead and take this out of its package. And so I will measure the distance from the right nare to the xiphoid process. So start here and then go around the patient's ear and then down to the xiphoid process. So we'll say about 46. Then I would go ahead and mark that with my marker here. 46. So that I know where to stop. Okay. So then I could go ahead and wrap this around my index finger just to warm it up. And then prepare the lubricant. Okay. And I will go ahead and open up my syringe. All right. Okay, so I would prepare the lubricant here, open that up, squeeze it out, and lubricate the tip of the NG tube here. Then I would go ahead and prepare or hand the patient this glass of water here. And instruct the patient to hold their head straight up and extend the neck back against the pillow for the first part of the procedure. And then I would let the patient know I'm going to go ahead and insert the NG tube, and I would begin to gently insert the NG tube by Alright, so I'm going to go ahead and insert it into the nair. Oh my goodness. Alright, and then point it downward and ask the patient to hyperextend and to be drinking the water and swallowing. And then I would go ahead and ask the patient to drop their head down and continue to advance the tube and to drink their water and swallow. And I would go down, as long as I'm not met with resistance, down to the 46 here, and then go ahead and hold it right here while the patient is sipping and swallowing the water. All right, and then I would go ahead and secure it right here with a piece of tape, just temporarily. All right. And then I'm going to ask the patient to speak. If they can speak clearly, then I know that it's not in their esophagus. And then I'm gonna aspirate 10 milliliters of content in the tube here. By removing this. Aspirate 10 milliliters. And go ahead and put it in the cup here. And then I would check the pH of that with this strip here. Make sure the pH is normal, 1 to 4. And the color and consistency is appropriate. I'll then go ahead and listen to the lung sounds. So the patient will take deep breaths. All right, and then after confirming that the patient isn't in any respiratory distress, I would clamp the end of the tube and apply the tape to the nose. All right. Okay, so in order to do this, I need to just go ahead and remove this tube. And then apply my split tape to the nose, wrapping one side of it around and back up, and then, or just around the tube, and then the other side to the nose. And then I would tape that down with another piece of tape. All right. And then I would use another piece of tape to wrap it on the tube and then to pin it to the gown, like so. I have a hair clip, but I'm just gonna go ahead and like pin that to the gown. And then I would need to make sure the head of the bed is above 30 degrees so the patient does not aspirate. And then I would just go ahead and make sure the patient doesn't need anything, remove my gloves, perform hand hygiene and make sure the call bell is within reach, and record the 46 into the documentation, and that will be all.